Hi, everyone. I'm François Picard. There are those who are confined, and there are those who are covering the confinement. Let's go to New York City. And Craig Ruttle, photojournalist with Redux Images. Thanks for speaking with us here at France 24.
Good, Francois. Thanks for having me on.
Thanks so much for joining us. You've been going out to all five boroughs the past month. And New York City, one of the global epicenters of the coronavirus pandemic. And we've been reporting on the field hospitals set up in Central Park. It's also morgues, though.
Well, that's right. And what's been happening is, along with the medical examiner's office, which is sort of the main, it's in Manhattan near Bellevue Hospital. They've actually set up a long tent. It's sort of a receiving type affair that leads ultimately to some refrigerated trucks, trailers that belong to like a lorry with a trailer.
And this is on the east side of Manhattan, what we're seeing.
This is indeed on the east side of Manhattan, and it's right behind what is a somewhat famous Bellevue Hospital, which is where the morgue has been located for decades in New York. But along with that, there are sort of smaller versions of this popping up at hospitals around the city. And in the last couple of days, and I went to try to witness this yesterday, but I was a little bit late. But for a short time anyway, they literally were wheeling the people who had died out through the street out to these trailers.
You've also been out to the other boroughs, because the pictures we're seeing around the world are the ones of course, of Manhattan and the iconic sites. But it's been something to behold in other boroughs, like Brooklyn, with this picture, for instance.
Yeah, and this was yesterday. Just to be accurate, not that you're not being accurate, but I did not make it to Staten Island, nor have I been to the Bronx. But I have been to Brooklyn, Queens, and Manhattan, the three of the five boroughs. And in this situation yesterday, this is at a small hospital, the Brooklyn Hospital Center, and outside of the emergency room, what you're seeing are these tents set up where they're receiving potential patients, and they're essentially testing them to make sure that to get them into the hospital in sort of the proper order. In other words, COVID-19 suspected cases or not. But everybody is passing through and being tested. And of course, what you're seeing there is one of the frontline workers who, as you can see, they're taking this, very seriously, and they're spending hours and hours around people who are potentially infected.
Yeah, it's. I've heard one healthcare worker, Craig, describe this as you're trying to run a marathon at the pace of a sprint. That's what one healthcare worker was saying here in Paris this Wednesday. You went to Queens, to the Woodside neighborhood, where confinement looks almost scary in the pictures you're taking.
Well, it's so the interesting thing about Queens. So I originally went out there, or one of the things I did was I did go to another hospital site in Elmhurst, and then as I was leaving, I went through this is sort of one of the next neighborhoods over Woodside, and what you're seeing is a store employee trying to keep a proper spacing between shoppers and also keeping the number of people in the store at a reasonable level.
Were there a lot of shoppers?
Yes, there were, and in this particular picture, what you don't see is behind me, there's a number of people waiting in line. And of course, I'm trying to keep my own distance as well, as safely as possible. But yeah, so it was unique in that people are finding unique ways to try to control their environments, whether they're in a store or, in this case, using a stop sign to keep people at a certain distance. Not to make too much light of it, because frankly, it looked like it was working pretty well.
What was the mindset of those shoppers? Were they good natured? Were they on edge?
Yes, I would say it's a mix. I mean, sometimes for the most part, people have been quite pleasant. You have seen the mood change from as little as 2 weeks ago, when I would go to the store and I was starting myself and starting to understand this. You could see people were very serious. They were darting around the store, keeping their distance. But there were people that were just kind of walking as if nothing had happened. But now I'd say, you know, virtually everyone has seemingly their body, their body language is telling me that they're taking it seriously.
Yeah, that mood changing when you took this picture, for instance, did it really hit home?
Well, again, this is also in Woodside, and I think that, so you go from the store environment, which I just showed you, which has a little bit of lightness to it because of the gentleman with the stop sign. But when you're out, when you're looking the other direction and looking at the street, you can see it's a rather stark environment. There's very few people on the street. This is a very busy, this is a real neighborhood, you know, a real city neighborhood in Queens. And it's, especially on a Sunday, there's, you know, food shops, ethnic food stores along this stretch of fruit stands. And this would be on a normal Sunday, you'd probably see dozens of people in this image.
Yeah, it's not the New York that we're used to seeing. A few nights ago, you went down to Times Square. Did you ever think it would ever look like that?
Well, I have to tell you that we, you know, as this has been evolving, when it first started, there was, I'm taking a stab at this, but I'm assuming the people I were seeing were people that had come to visit the city. This person, I think, was a New Yorker, but there would be a handful of people on Times Square, and they appeared to be, you know, tourists. But as the days went on, even those people just eventually just sort of disappeared from the scene. So it ended up becoming day by day, the fewer and fewer people, and yeah, and to answer the question, no, I don't, with the exception of a couple of maybe steam pipe explosions where people had to leave and then they came back within hours. So no, nothing like this ever.
Yeah, because some of those pictures, it looks like something out of a science fiction movie.
Yeah, and I think in this image, so as you can see, this refers to sort of that earlier period. There were more people mingling around, and yet there were people starting to show up in various arrangements of safety cover, if you will. I think some people were.
Seeing that?
Sorry?
Are you still seeing that? People kind of improvising and.
Yeah. Sorry about that. Yes, I am. And I mean, some of it certainly, you know, we're learning a little bit too about some of these things. Actually, even a bandana may not be a bad idea. Not necessarily not to catch something, but perhaps to protect other people if you were perhaps not knowing you have COVID-19. So, but yeah, I'm seeing what seem to be even fashion forward things on people's faces, which I think are actual devices. They just you're seeing a lot of things, but generally speaking, you're seeing surgical masks, people wearing gloves.
What's that person holding in that photo?
Oh, that person was putting. Actually, that's a good point. That person seemed to be setting up a little tripod just to take some photos, to take a little video, I think. So the aspect of that person visiting was it was a woman who was doing some pictures and things. I'm pretty sure that's what I remember about that moment. So point being is that she was there, and even though she was sort of suited up, she was still sort of drinking it in, so to speak.
Drinking it in. You told me, Craig, that you're no longer using the subway to go out and about for your assignments.
Well, yes, that's true. And this was strictly, so I'm a kind of person who's on the subway at times hours a week. And I've just decided, just out of sheer caution, to stay on the surface, just as part of my own safety regimen, so I can keep working. I think that the subway, I think it's still relatively safe. It's just a personal choice. Some people have no choice. Some people must use it. And I think it's dicey. I think you have to protect yourself in a different level there. There's so many surfaces to touch. So I've been using the surface. I've been using mainly either my feet or a bicycle to get around, or renting a car.
Or renting a car. Craig, so much has happened. since 1 month ago, March 2nd, when the mayor and the governor first staged a joint press conference to talk about COVID-19. At the time when you covered that press conference, did you think it would come to this?
Absolutely not. I mean, I think we knew it was here. We knew what we knew from overseas. We knew it was coming, and actually, it's pretty interesting. I covered a parade in China, in the Chinatown neighborhood, and forgive me, it was the Chinese New Year celebration, and this was obviously before this, and it seemed at that time that New York was more or less in a safe place. The neighborhood was open, people were cheery, and then on March 2nd, of course, we have this incident, this reality, really. And just about a month ago, I don't think any of us would have imagined the numbers that we have now.
And we read in the press here that everybody's waxing lyrical about Governor Cuomo, who had the reputation of being a bit of an abrasive personality before all of this. Well,
I have to say that I have a certain distance in opinion, just as a photojournalist, and if that could have been the popular thought about him, that he's a tough politician, that he gets things done, in his own way. But I think it's fair to say that I'll use the word leadership here. I think he's really being praised. For instance, and it's not necessarily just an East Coast thing. I have a friend who has family in the Midwest, and she's talking to her parents, and they've even noticed, making some comment about, wow, that governor guy you've got, he's something else. So I think opinion about him has been pretty interesting, and he
one of the big surprises, you might say.
Well, yeah, and it's not just about his personality either. And he's obviously he's got an interesting sense of humor, and I think it's been really, I think, a lot about his the conviction to this particular issue, and he seems to be hitting the right tone virtually every time. Every time he has something to say, every time he creates a hospital, for instance, or has other facilities that are being built in the city or being developed as this thing unfolds. And of course, at times it seems he's at odds with the president, and that's well known, that's well publicized. But even through that, I think he's managed to keep actually a pretty level tone in his approach to even that situation.
One final question for you, Craig Ruttle. When you compare to what New York City was like in the aftermath of the attacks on the Twin Towers in 2001, what can you say about then and now?
I know people that seemingly are much more sheltered in this situation than they were then. Because yes, there's this coming together of the city and people being strong and being one. But at that point, you could go out on the street and do it. And you could hug people, and you could shed tears together, and you could kiss and be in community, literally touching one another. And in this case, you can't. And I think that's the main thing that's got people so rattled.
Well, our thoughts are certainly with everybody in New York City. Craig Ruttle, so many thanks for taking the time out to speak with us here at France 24.
Thanks, Francois. Let me just say, too, along with New York City, I think a lot of people realize this is just so much further than New York, Europe, Asia, and beyond. So I think, yeah, we're definitely here. We're definitely worried about New York, but I think a lot of people understand it's bigger than us as well.
All right. And Craig Ruttle's photos can be seen on his Instagram account at RuttleMan. Thank you. And there's more news on France24.com.